Hey everybody, welcome back to my channel. I'm Dr. Perkins, I'm board certified OB-GYN, and today we're talking about natural remedies for yeast infections while pregnant. This topic is important for a lot of reasons. One, we know that yeast infections are quite common. We know that yeast infections while pregnant is a very serious condition in that we don't want to get treatment without your providers being involved because of pregnancy. We will talk about the things that will be important to consider as treatment options that are not antibiotics, they're not antifungals, and they will help reduce a yeast infection, as well as we will dive into what a yeast infection is and all of the things surrounding this. If you hang around until the end of this video, I'll be sure to offer you and give you, with all pleasure, a very beautiful gift, a free gift. If you hang around, you'll get that information at the end. For now, let's talk more about what is a yeast infection. Yeast infections, like I mentioned, are very common. Up to 75% of females during their reproductive years, that's the time between puberty all the way to menopause, they will get at least one yeast infection during that time frame. And so in pregnancy, things are no different. Well, we say no different in that you can get a yeast infection, but what actually changes internally is that when you're in a pregnant state, your hormones are, I'm going to say all over the place, but there are just so much more hormones, the estrogens and the progesterones and all the things in our system, and this increases the likelihood of you getting a yeast infection. In addition to all those hormonal shifts, also know that during pregnancy, there are more glycogen in the vaginal space as well. What is glycogen? A sugar component. Sugar is the perfect food for yeast. Now remember that yeast lives in the vagina normally. And so if you were to add more sugar to the vaginal space, which happens naturally because of pregnancy, it is creating the perfect environment for yeast to thrive. And a yeast infection is an overgrowth of yeast in the vaginal space. Research also shows that when people are diabetic, when we have diets high in carbohydrates and sugars, patients or people oftentimes will get more yeast infections. So there is a very direct link between sugar and yeast overgrowth in the vagina. And so this is a part of the reason why it is so common that many pregnant women will have yeast infections at some point. Now, before we continue, I do want you to be aware of what the symptoms or what your discharge is like when you have a yeast infection. Now, in most pregnancies, I tell patients that the vaginal space is almost like a slippery slope. There's a lot of discharge. That discharge will change tremendously from the first trimester to the second to the third, and not to mention when you're in labor and postpartum. There's a lot going on down there either way. So how do you know if you have a yeast infection? Well, number one, having vaginal irritation or inflammation. This is very common. You feel swollen down there. It can be like burning in sensation in the vulva or your vaginal lips. You may have a thick, white, or clumpy vaginal discharge. This is probably one of the most common changes to your discharge. But I can tell you that there are so many times that you have an active yeast infection, but not necessarily have that thick, white, cottage cheese type discharge. Another common finding is having lots of itching. And so if you're pregnant and you're having any of these three things, the first thing that I want you to do is to go to your doctor, make an appointment with your OB, and it doesn't have to be a doctor. It could be your nurse midwife, a nurse practitioner, whoever is taking care of your pregnancy at the time, and tell them that you're having these symptoms. And the reason is, during pregnancy, we want to first be sure that we do have an infection. We want to be sure that the infection that we have is actually what it is. because oftentimes we self-diagnose and self-treat, but we could have another issue like bacterial vaginosis or an STD. And so now we're being exposed to medicines that are not necessarily treating the correct problem. And so because of that, you absolutely want to get a true diagnosis from your provider before attempting any treatment. Now, at the same time, treatment is important because if not, an untreated infection can lead to preterm problems like preterm labor or even preterm delivery. And these are things that we don't necessarily want. We also know that these infections can move within our system. And by that, we call it ascending, meaning that the lowest part of our tract or vaginal area would be the vulva, then the vagina, but then these infections can move upwards towards our uterus, our pelvis, our baby, and these are things that we don't necessarily want. So we want appropriate and timely treatment. So now we're here to talk about all the natural things that we can do to help to treat a yeast infection. So let's talk about that. Number one on my list here is probiotics. Everyone should support their gut, their vaginal space with probiotics. When we think of the vaginal space, need to be specific to things that grow in the vagina. And so when you're choosing your probiotics and we're thinking about the vaginal space, we want to make sure that Rhamnosus is a species that is being covered by your probiotic. The easy way to think about this is the one that starts with an R, okay, Rhamnosus. And so most probiotics that say they're covering vaginal health will have this species covered. And so it is important because the bacteria that lives in our vagina, or microbiome, needs more Rhamnosus. And not all probiotics work in the vaginal space. And so we want to look for this on the long list of different bacteria that is being covered in the cultures that are being covered, to make sure that the R1, Rhamnosus, is included in the ingredients of your probiotics. The second thing I absolutely recommend is coconut oil. I love coconut oil. Coconut oil for my skin, to cook with, coconut oil for cradle cap. I mean, coconut oil is just amazing. And the reason is it has antifungal properties. Now, let's backtrack a little bit. A yeast infection is a fungus. It's a fungal organism in the vagina that overgrows. And so when we're treating a yeast infection, the medical term is candida, we want things that are antifungal. Coconut oil has antifungal properties. This is why it works so well with helping to keep infections at bay. But while you're pregnant, I do not recommend that you use this coconut oil vaginally unless your provider says that it's okay for you to do so. If you're having itching and inflammation and irritation on your vulva, it is completely okay for you to use some of that coconut oil and just rub it on the outside and coat your vulva, and you should start to feel relief. I'm gonna say immediately, but really relatively quickly. The next thing that I would recommend to use is apple cider vinegar. And if you've heard of this, you may have heard of ACV baths, okay? So essentially you have water and you add apple cider to this and you kind of soak in it. In general, we're using about 1 to 2 tablespoons of apple cider vinegar to about a quart of water. And so this helps to reduce infections within the vulva, because just like coconut oil, apple cider vinegar actually has antifungal properties as well. And so it can help to reduce and treat a yeast infection. In general, these things that we're placing on the outside of our vulva doesn't necessarily get to the inside of the vaginal space where this yeast infection may be coming from. So you may have symptomatic relief, but you might not necessarily be curing the entire infection. And so because of that, again, in pregnancy, very important that you get appropriate diagnosis, but in general, you want to make sure that you are getting the appropriate treatment as well, because oftentimes we want the treatment to go from the inside out. When we're using topical treatments like the coconut oil or the apple cider vinegar baths, we are treating on the outside and not on the inside. So see your providers and get appropriate treatment as well. Boric acid is the next that I like to mention. Boric acid is a wonderful option to help to treat a yeast infection vaginally when you're not pregnant. Even if you have no conversations with your provider, do not try to use any boric acid suppositories during your pregnancy. When you're not pregnant, different story. You can absolutely use this to help to maintain the vaginal space just well. It just works really well at creating a more stabilized environment by providing your vagina with more acid. With more acid, your microbiome is more stabilized. It is able to maintain all the bacteria and yeast that lives there and keeps it happy. And so boric acid helps to restore your vaginal space, making it less likely for infections to occur and remain in the area. Now, another thing that we can use or we can increase in our diet is garlic. Garlic also has antifungal properties. And with that, you're able to decrease the likelihood of an infection happening and decrease an infection if it is current. Now, don't put garlic directly in its raw form in your vagina. That is not what I'm saying. Please don't do that. However, if you were to take garlic supplements, if you were to increase garlic in your diet, this is enough to help to support your immune system and to help keep your vaginas happy. Lastly, I'd like to mention essential oils. I'm going to mention it here because there are essential oils that have antifungal type of properties. Things like tea tree oil, for instance, that may help. The danger in using these are, I'm going to say, twofold. The first is that these oils need to be extremely diluted. It is very hard to trace where your essential oils are coming from, their potency, or even to be comfortable and sure that the dilution is appropriate for you. And so if you were to use these oils in some format that is too strong for your vaginal space, you may end up causing a lot of irritation in your vagina, and this could be a problem. May they work, or could they work? Absolutely. Do I recommend them? No, but it is a possibility. The reason why I truly don't recommend essential oils is that they can cause endocrine disruption. And this means that internally within your body, essential oils can mimic what your hormones typically do. And this can cause your body to not respond to your internal hormones well. And essentially, you can cause infections, irritations, and inflammation. You can cause disease, things like even cancer. And you can really just disrupt your hormonal picture in a way that can lead you to being completely unstable. And so because of this, I don't highly recommend that we do these things, and especially not during pregnancy. Well, do we have a lot of options for things that you can do naturally to help to treat a yeast infection, especially during pregnancy? No, but there are some that are helpful. Overall, not wearing tight clothing, making sure that we're supporting our bodies with probiotics and eating well and exercising and letting our vaginas breathe. This is all a good start. But the most important thing when you're pregnant is making sure that you are thinking about safety first, the safety of your pregnancy, your baby, and your body. So you see a provider, you get the appropriate treatment, and even if you want to try some of the natural things we talked about today, make sure that they give you the clearance and give you the go-ahead to try these things at home. I hope this information has been helpful for you. Please let me know if you have any questions or concerns down below. And as I promised, I would love to send you a free copy of my ebook for listening today. Hormones don't lie. We are hormonal people. And so we can navigate this life together and in a good way if we have the right support. And I'd love to start that for you. And so if you'd like this, click the link below and I'll be happy to share it with you. Thank you so much for listening today. It's been a pleasure as always. Thank you for being here, and I'll see you next time.